Hi, this is Dr. Pollard, and I'm greeting you today from the Rockville campus, where I stopped by the Godelski Institute to observe the transformations that we've been making to prepare the campus for students and employees as they visit us. Most important about this, we're all living through this pandemic, but the college has taken several precautions in place to make sure that it's safe for those small number of employees and students who have to visit us right now. Important in this first is that if you're feeling ill, do not come to campus. And then before you come to campus, it's important that you complete an online health assessment that you will have to show once you come to the campus to visit. When you fill out the self-assessment at home, you have to respond to a series of questions about how you feel that particular day. Then you'll be given either a red X or a green check like this one. It's easy to do and only takes a few seconds. The most important thing you can do is prevention. Don't put others at risk by coming to campus if you may be sick. If you don't get a green check on your assessment, please stay home. We have already proven that working, teaching, and learning can be done remotely. Employees should have completed their online health protocol training prior to returning to work, but both students and employees must complete the daily health assessment, and once they have their check, show it to the public safety officer upon their entrance to the campus. And then they will ask to record your contact information in case there's a positive case reported. Then we'll know who is here, on what days, and can get in touch with them. Contact tracing has been shown to limit the spread of the virus, so we're organized to do it accurately and quickly, but only if we have your updated contact information. Once you're on campus, you'll be required to wear a mask and to practice social distancing. These are not optional, they are required. People who don't comply can be asked to leave the campus. Of course, if you've forgotten your mask, we can provide one for you. Another habit we've gotten used to is washing our hands frequently. We all know how important that is these days. To make it even easier, touchless hand sanitizers will become frequent sights on campuses. You'll also get reminders about social distancing with these markers on the floor. Wayfinding will also be made seamless so that people won't crisscross so often. The key is to keep your distance from others for your own safety and theirs. The Coronavirus Advisory Team has worked closely with public safety and facilities to plan all of this out based on best practices. So just follow the cues you are given. You may be surprised at how easy it is to stray from them. There's a normal human instinct to get closer to others when talking or reuniting with friends we haven't seen in many months, but we have to resist that. You'll see signs that will alert you to the maximum number of people who can be in a room at any one time. In bathrooms, alternating stalls may be closed off. In classrooms, desks may be roped off to keep people spread out. Some things you should know about what are happening behind the scenes, such as enhanced cleanings. This will be especially important in spaces where people share high-touch items like computers, elevator buttons, doorknobs, desks, and bathroom stalls. Even though our housekeeping staff will be working extra time, we all need to stay aware of those items or surfaces that others have touched. Wash your hands frequently after you have been in contact with any of those surfaces. And remember, try not to touch your face. Some protective measures haven't yet been put in place, but will be here when we have more folks on campuses. Plexiglass will be installed in places where people have to communicate closely, like where you pay for food or interact with public safety. More markings will be added to places where lines used to form for services. And more of those services will rely on appointments or remain virtual to reduce contact. Another thing to remember is that you may want to bring your own bottle of water to campuses, as we've closed off the water fountains. It's just too high touch to be worth the risk. And we will have the option to keep certain areas off limits if they're deemed too high risk, such as workout rooms, the pool, or very small cubicle meeting areas. As we learn more about the transmission of the virus, we may adopt new processes. That is still an open book right now. But we've learned some really good lessons as we've progressed. Hearing over masks has been one of them, and some instructors are now using special equipment to make sure that they are heard. We've also learned more about how to communicate with employees and students when a positive test is reported on campus. We have quick, efficient protocols for informing close contacts and for disinfecting areas where the person was present. Regardless of all of this, washing your hands, wearing masks, and social distancing are basic steps you can take to reduce infection. All of them are encouraged by the Centers for Disease Control and our CAT team. I hope you've enjoyed this opportunity to take a peek into what's happening on campus, even while most of us are away. I'm grateful that we've had such wonderful support from the community, but it's also important that each of us take responsibility for our experiences here. When we have the opportunity to come back together on campus, I hope that you will take an opportunity to follow the rules that are here and be a part of the solution that's necessary for us to stay healthy and to stay well. With that in mind, I hope that you've enjoyed this opportunity, and I look forward to the time when we're all together as a college campus. Until then, be well and stay healthy.